Good afternoon. This is Bill Bazzi, Mayor of Dearborn Heights. We're doing a run the town tour. I'm standing here at Garden City Hospital with Dr. Christopher Doig, and would you like to introduce yourself, Doctor?
I'm the Chief Medical Officer for Garden City Hospital.
It's nice. It's a pleasure. It's an honor to be here with you. We've had some of our residents. They have some questions. And, a lot of our residents from Dearborn Heights, they come here to Garden City Hospital. And, when they come here, they either visit family members or they're, some of them are admitted to the hospital. So I know with the pandemic that we're currently in, there's been a lot of questions. So I jotted some questions down.
Okay.
First, what I'd like to ask you, Doctor, is just general questions on Garden City hospitals, the number of beds, what type of hospital, what level hospital this is. Also the general staffings, the number of employees,
Okay.
doctors, that kind of stuff.
Yeah, this Garden City Hospital is licensed for 309 beds. We don't operate 309 beds now, but that's what we're licensed for. They have 1,400 employees, roughly 350 professional staff physicians. It's a level 3 trauma center through the emergency department. It's a platinum certified stroke center and also cardiovascular specialty center. Do a lot of intervention for strokes, heart attacks, a very active lab with a lot of interventions. We serve the Western Wayne County area, anywhere from the border of Detroit to Canton in the west, and from Romulus to parts of Livonia. So we're quite concentrated around Garden City, Dearborn Heights, Westland, and then a little more less as you go out. But this is our normal range.
So, Doctor, what type of services does Garden City provide to the community?
It's a full-service hospital with a few exceptions. We don't have an open heart surgery program here, but we have surgery, the cardiovascular services, orthopedic surgery specialty. All the other surgical subspecialists are here, and then the full range of medical specialists as well, which would be like from cardiology and gastroenterology to pulmonary medicine, critical care medicine, and it's a teaching hospital. Mm-hmm. This has been a teaching hospital for many years. We train the future doctors in all these specialties: medicine, family medicine, surgery, obstetrics and gynecology, neurology, cardiology fellows. We have a very broad training program.
Okay, so one of the things, during the pandemic, when the beginning of the pandemic, we had a lot of numbers. The numbers spiked. It was pretty high up with COVID, and it kind of tapered down for a little while. Right. But all of a sudden, we're seeing a huge spike in our area here. Would you like to shed light on what really caused that?
Well, it seems to be a combination of factors, and partly due to the variant strains being a little bit more contagious. And it so happens Southeastern Michigan has a lot of these variant strains that they're assessing now. So the exposure probably has been the same. There are people that are not being really vigilant about wearing the mask and social distancing and washing the hands, which all those things really do work. But they tire of it. There's a lot of fatigue. It's been too long, over a year. And when you get that lull and things seem okay, people, it's almost like a celebration. They just start milling around more and seeing each other more. So now with this new variants in our area, we're seeing an uprising of the number of cases again. So we have a lot more cases than we had in the summertime. Even at the 1st of March in our hospital, we got to the point where we only had 3 COVID patients in the hospital. And now for the last several weeks, we've had 40 or more. And the worst part of now is the critical nature of it. There's too many really severely ill patients again. It had gotten where they were milder and then we were getting them out. But now we have too many patients that are ventilator dependent, and that's a very, very prolonged illness. Those patients linger for a long time without showing any signs of healing, and sometimes for months before they finally get better. So that's what's kind of really gripped our hospital now, is the critical care is at maximum. And in fact, we decided we're going to repurpose part of our cath lab as a second ICU, which we had to do a year ago. We had 3 ICUs running a year ago when it was really high. Hopefully we will not see those numbers again. But that at one point we had over 100 COVID patients a year ago. And we had run 3 ICUs. This time it's going to be like 1.5. And hopefully that will serve our needs for our patients and our staff. So it's real. And it's an ongoing threat, even for those of us that are vaccinated. Can't let the guard down because we have to show the general public, this is how we make this stop. Get vaccinated, wear the PPE, the personal protective equipment, wear what you have to stay safe. It's the only way we're going to make this finally go away. And we will. Eventually, this will go away. I mean, vaccination is really the ultimate method.
Yeah. So, Doctor, some of the people, I mean, I've known people, have family members, they say the same thing. Obviously, I've been vaccinated. I have both my second shot with Moderna. So some people think this is a hoax, and they don't believe in the shot. What would you like to say to the ones who think this is a hoax and made up?
Yeah, that's a common theme for a subset of our population. They just don't want to believe that this is real, or they believe that it should be viewed as the common cold because it's a cousin of the common cold. And of course, not many people are really going to get terribly sick. And I can't do this. I've said many times, I wish I could invite those people to come into our hospital and see our COVID floors, see what all the nurses and patients are going through. You would know this is no hoax. And you would not take a chance on getting that disease that we see in our ICU. Would not take a chance. It's unbelievable how critically ill these patients have become, how long this illness is, how it's devastated their lives. Patients have been in our hospital 90 days. They can't go home. They're too weak. They can't even go home. They end up in another facility and at risk for more problems. So it's very real. It should be treated that way with extreme caution and attention to detail. Mask, wash, keep your distance. We know that their guidelines now say that patients that are both immunized, they don't have to use the mask or social distancing. But our point is, until we get an all clear, everybody's wearing them. You just have to be the example.
Yeah, I've known several people that actually got they had the COVID, and it's definitely not a hoax. We have some family members that have gotten the disease, and some of them, like you mentioned, Doctor, it takes them a while to get through it.
Yeah.
And even though there's one of a good friend of mine, who's an athlete, and I mean he runs, he does weightlifting, and he does everything. He thinks, I mean, this guy doesn't even put any sugar in his body. Yeah. And he got it, and it took him almost 2 months to get rid of it.
That's
so
right.
It is serious.
It's a devastating illness for those who get the bad variety, and you're rolling the dice if you're going to take a chance on getting it. You don't know how it's going to affect you.
Exactly.
And it's not just if you're sick. If you have chronic conditions, it's worse, predictably worse. But I've taken care of young, healthy people in my ICU here.
Yeah,
it's bad.
So, Doctor, do you believe that we have the measures, we have enough measures currently in place or sufficient tools to stop the spread of virus?
Oh, I believe we do. And in fact, now we're seeing that there is such a good supply of the vaccinations available that we have open times in our clinic here. And almost all clinics now have open slots. We need the patients to come forward and take the shot and get the vaccination because of the concerns about the scare over the J&J with the blood clots and the general theme of it's a hoax. There are too many people that are sitting on the sidelines not coming forward for their vaccination. But vaccination ultimately is the only way to make it stay away.
Okay. So I know, talking to some of the staff members here at the hospital, you guys are offering the vaccination here. Would you like to shed some light on, the type of vaccines that you have available at Garden City Hospital? Sure. And also how can people actually get the shot? Yeah,
we've been giving vaccines since they first hit the state of Michigan. Initially, we got a supply of Pfizer vaccine, and we went through that, and they followed up with Moderna. We are currently giving Moderna vaccine to all of our recipients now. The J&J, we just have a handful of them, and we have it available, but we're not offering it because it's too confusing in the clinic who's getting what. We're staying with Moderna, and we are just have those available if we ever run out of Moderna. The vaccine can be obtained by calling. There's a number on our website. You call that phone number and you can say, I'm interested, especially if you've ever been a patient here in any way. We want to take care of the community. For a while, they had it on a website where anyone could sign up, and we were getting people from all over Metro Detroit filling up our slots, and so our local people couldn't get in. So we changed our method, and we actually call and we make appointments for former patients. We call them every day, and we offer appointments to them. And by the same token, though, if you call in and say you're interested, we'll put you at the top of the list and we'll get you in.
Well, you actually answered my next question.
Oh, good.
but with that, so eligibility, is there, I know there's age, are you guys concentrating on certain age right now? I know Moderna is over 18, obviously.
Correct.
But eligibility, and also for insurance, if somebody doesn't have insurance and they want to get the vaccine, so how
anyone can get the vaccine, insurance or not. Everyone is eligible for the vaccine. There's no charge for the vaccine itself. The government has paid for that. So anyone can get it and should get it. We're immunizing just what the state allows, 16 and up. There's only certain products that are approved for 16. Like if we get some Pfizer, we give that to 16-year-olds. Moderna's 18 and up. So we're using Moderna, we're giving anyone and everyone 18 and older. You don't have to have any other preconditions.
Okay, so doctor, for the COVID testing, I know that you guys still do COVID testing. So some people are still wondering, how can they get COVID testing from the hospital? And also, if they tested positive, would they be eligible to take the vaccine?
Okay, yeah. So we are doing COVID testing. We have a drive-through that we cooperated with the Wayne County to set up. Currently, it's operational Monday, Wednesday, and Friday because the volume we couldn't handle with all what was going on inside 5 days a week. So Monday, Wednesday, and Friday is our drive-through testing. And if you're positive, you'll get a call from the hospital. One of the doctors calls all the positive patients and tell them they're positive. As far as getting vaccinated after having COVID, the guidelines say that if you actually have COVID, you have to be at least 10 days since your first symptoms, and you have to be improving and without fever, then you can sign up for the vaccine.
Okay. So I think you pretty much answered all my questions, doctor. The only thing that, let's see, they have, what is the most effective measure for individuals, and what should they do to avoid, contact with the virus?
Well, the same guidelines that the CDC has been pushing all along. So it's social distancing, wearing masks, not going into big crowded areas, and just staying away from strangers, so to speak. It's not very friendly, but it's got to be a temporary thing so we can get this to stop, and then we can go back to our regular social community that we are and we like to be.
Yeah. Again, thank you, doctor. We appreciate having you today and explain to our citizens from Dearborn Heights. I know there was all these questions. They've been sending us a lot of questions. They've been asking, they're concerned about the virus, especially now with the numbers spiking. They're saying that, the numbers are a lot higher than when this pandemic started.
Yeah.
So we appreciate your help. We appreciate Garden City Hospital. And I know that you have a good partnership with Dearborn Heights, and you guys offer the service to vaccinate our citizens, and we appreciate it.
Our pleasure.
Yeah,
our pleasure. Yeah, you're right in our wheelhouse.
Yeah, thank you.
It's our neighborhood.
Thank you. And again, for any of the residents, if you have any questions about COVID testing or COVID vaccination, please reach out to Garden City Hospital. As the doctor mentioned, they have on their website. Yeah. Or you can just reach out to the mayor's office. Again, thank you. This is Mayor Bazzi.